My name is Glen Crawford. I've been at Atlantic Orthopaedics for 6.5 years, and I'm an orthopedic surgeon. And so the hospital has gone through quite a commitment to improve the quality of trauma care, and my position is called the orthopedic liaison, and I take care of most of the orthopedic trauma issues in the hospital. I did do some special training at the end of my residency, and then I've always really enjoyed doing that because it can be very, very challenging. Unlike some things where you do a lot of the same thing over and over again, it's always different. Both the patients and their injuries and how we have to put them back together. But there are many, many things we treat now that we would not have treated 3 or 4 years ago. Well, a lot of people, including my wife, think it's because I grew up working as a carpenter. And a lot of the tools are the same, the drills and saws and things like that. And it just, when I did my rotations in medical school, I just naturally gravitated to that because a lot of things look so familiar to me and I had experience with them. I started a program in Tanzania, and it's teaching orthopedists how to take care of people in the best fashion, so it's really oriented towards teaching. My wife and I started doing this at the end of medical school, and then once we finished residency, we started doing volunteer work with a group called Orthopaedics Overseas, and we've done, I think, 17 trips now. There are a lot of very inexpensive motorcycles, and people don't really know how to drive them well, so there's a lot of high-energy motorcycle injuries. A lot of people fall out of trees when they're getting fruits and coconuts and things like that. I've seen lion maulings and people shot by arrows when they were trying to steal someone's corn. There's some pretty weird things. Well, the people there just don't have the things that we have here. And there's a tremendous brain drain in countries like that where people who are trained leave, and a big reason they leave is because they can't do the things they were trained to do because they don't have the equipment. And they're just like orthopedic surgeons here. They like to take care of patients, and if they see patients they know how to treat and they can't, it's very frustrating. So this is to try to help that frustration and keep people there, but also the quality of care for the patients is so much better.